Okay. Now, out of the 25 to 30 questions which will be there in cardiology in MRCP part 1 and part 2 theory examination, most of the questions will have clues on heart sounds or murmurs and JVPs. So, revise this video at least 5 to 10 times before going to the examination. This is that important. So, S1 is due to the closure of mitral and tricuspid valve. It can be soft or loud. No, soft is when in cases where the PR interval is long and mitral regurgitation is there. It is loud in mitral stenosis, in Eisenmenger syndrome, and where condition from left to right shunts. Short PR, it will be loud. So LS, that is how you'll remember this. And atrial premature beats, they will have loud S1, and hyperdynamic states like pregnancy, anemia will have loud S1. So this is one of the most common heart sounds which you will encounter in your clinical practice. S2 is due to the closure of aortic and pulmonary valves. Okay, so this will be soft as in aortic stenosis. Normally it is split. Okay, and so it will be either wide split or reverse split. Okay, wide split S2 is seen in right bundle branch block, in deep inspiration, in pulmonary stenosis, and severe mitral regurgitation. So mitral regurgitation will have two types of sounds. In severe mitral regurgitation, there will be a wide split S2, and in normal mitral regurgitation, there will be soft S1. S2 will be fixed in atrial septal defect. It will be soft in aortic stenosis, loud in hypertension. Now, in systemic hypertension, the A2 will be higher, and in pulmonary hypertension, the P2 will be higher. Then reverse split will be seen in left bundle branch block, in severe aortic stenosis, in right ventricular paces, WPW type B, and patent ductus arteriosus. So reverse split is very common in questions. Then S3. S3 is due to the filling of the ventricles during diastole. Now, S3 is normal in less than 30 years of age and in 50 years in females. It is mostly seen in left ventricular failure, and it is one of the earliest signs of left ventricular failure, and that gives the gallop rhythm. It is seen in dilated cardiomyopathy, in constrictive pericarditis, and again mitral regurgitation. So here you have seen mitral regurgitation has got S1, soft S1, widely split in severe MR, and again S3 also you can hear. S4 will coincide with the P wave, and this is due to atrial contraction against stiff ventricles. It will be palpable in HOCM. Double apical pulse is seen. And aortic stenosis, you will see S4 and hypertension. So systemic hypertension again will have S4 and loud S2. Aortic stenosis will have S4, reverse split S2, and soft S2. Complete heart block will have variable intensity S1. Mitral regurgitation will have all of these S1, S2, and S3. So S3 will be heard, soft S1 will be there, and widely split S2 will be there. In case of hyperdynamic states, there will be loud S1 and loud S2. So this is all about heart sounds.